This short presentation is about shared decision-making and informed consent, which is pivotal to all forms of practice, but really important when we think about menopause care. So I'm just going to go through a few slides, which hopefully will make things a lot clearer for you. So just to summarise, what is shared decision-making? Well, everything we do in medicine, I feel very strongly that we have to involve our patients as much as possible so they can make the right decision for them. Any decision they might make might change with time. They might decide one thing one day and one thing the other day, which is absolutely fine. So anything is done in real time. Obviously, the more we know our patients, more we can understand about their concerns, their ideas, their expectations of that consultation and treatment. It's really important. And I'm very fortunate in my clinic that we have quite a lot of time to really explore this with our patients, which wasn't nearly as easy when I was doing very short 10-minute consultations in my general practice. So shared decision making involves a person and their healthcare professional working together to reach a joint decision about care. Now, I've put working together because this is crucial. When I was a junior medical student in the 80s, there was nothing about working together. It was really just telling the patient what they need to do. Thankfully, things have really changed. And certainly when I was learning to become a GP after doing many years in hospital medicine, it really opened my eyes to the way that every consultation is different. People's expectations are different. People's knowledge is different. And actually how that treatment might not just only impact them, but those close around them as well need to be taken into consideration. So we need to involve choosing treatments which are based on evidence, of course, but also on the person's individual preferences, beliefs, and values. And that's really important. There are lots of different cultural beliefs, ethical beliefs, all sorts of things that we need to take into consideration. And also, when we think about the evidence, it's not just the randomized control studies, it's not just the evidence that's in papers, it's clinical evidence as well. And putting those two together is really important because, after all, medicine is an art and a science. The science is looking at the scientific facts, but in my mind, the art is actually individualizing that care and treatment for each person. So we need to really make sure that the person, so our patient, understands the risks, benefits, and also possible consequences of different options through discussion and information sharing. And for the last 20 years or so, I've worked as a medical writer, and the power of being able to share knowledge in a very clear, transparent, easy to understand way is really crucial and pivotal for a lot of my work. Sometimes people need time to make a decision, so we don't always expect patients to make a decision then and there in their first consultation. And this joint process really does empower people to make decisions about care that is right for them at that time. And at that time is really important as well, because somebody might make a decision to have or not have treatment one day. And then when they've got more knowledge and information, or their symptoms might change, they might then change their mind and decide to have a treatment or stop a treatment. And that's absolutely fine as well. So the work that we do is based on the GMC, the General Medical Council's guidance, which came out 3 years ago now in 2020, and it's called Decision Making and Consent. And it's very clearly set out for all of us as doctors to work from. So informed consent, what is it? Well, actually, we need to be to know, it's very basic actually, that consent is a fundamental legal and ethical principle. And every patient we see has the right to be involved in decisions about their treatment and care, and they can also make informed decisions if they can. Some patients do lack capacity, but in most people, when they're consenting adults, they have capacity, then this is where it's really important that they have this fundamental right. And the exchange of information between the doctor or any healthcare professional and the patient is absolutely essential to good decision making. And in most healthcare decisions, we rely on a patient's verbal consent. Sometimes, actually, it can be a non-verbal consent. So, for example, if I want to examine someone's mouth and they open their mouth so I can look in it, that's non-verbal consent. They might not have said, yes, you can look in my mouth, but actually opening their mouth, allowing me to shine a torch to look at the back of their throat is a consent process. Sometimes, obviously, we need written consent. So, for example, if people have operations with more risks, then obviously written consent is really important. Most of us, when we're working consulting, consent is the patients come into the room, they've gone away with some treatment. We know that they're consenting to it in a verbal way through the conversation. And also, when we talk about risks and benefits, it's actually not reasonable to share every possible risk of harm, potential complication, or side effect. And the GMC are very clear about this. And they say we should tailor the discussion to each individual patient, guided by what matters to them. And that's really important as well, that every consultation certainly is different. These are 7 principles of decision making and consent that the GMC clearly set out, which I think are very interesting to read. I'm not going to read them out now, but I've just listed them there. So in the GMC guidance, it says we should discuss potential harms and benefits to each individual patient, being guided by what matters to the patient, as I said, and sharing information in a way that they can understand. And this is something that I've worked very hard at for many years, and certainly through the menopause work I've done, through the app, through the website, through my podcasts. There's lots of different ways of understanding the same information. So some people prefer watching a video, some people prefer listening, some people prefer reading, and increasingly we're translating information into different languages as well. So all patients absolutely have the right to be involved in decisions about their own treatment and care. And we know that harm can result if patients aren't listened to or they're not given the information they need to make informed decisions about their care. There's another guidance that's really important that came out a year after the GMC guidance in 2021, which is called the Shared Decision Making Guideline, which was produced by NICE. And this is really important. It supports healthcare professionals' skills and competencies. And this also says we need to communicate in a way that patients understand. And we need to share and discuss information people need to make informed decisions. And we also need to make sure that they understand the choices available to them. And interestingly, including the choice of doing nothing. And I think this is really important when we talk about HRT, because there's so much debate about HRT. There's so much negativity, often for the wrong reasons, about HRT. But we really need to do and think about what is the risk of not taking HRT? What is the risk to our well-being, to our symptoms, but also to our future health? What about our risk to heart disease and osteoporosis? Are we prepared to take that increased risk by refusing evidence-based treatment in the form of HRT? And that's something that we can all decide as individuals once we've got the right knowledge and information. The guidance says that during a discussion, when we discuss decisions about treatments, we do it in a way that encourages people to think about what matters to them and to express their needs and preferences. And as GPs, we have a lot of training in how we really tease that out in a consultation, how we ask very open questions, how we change our consultation style according to how the patient is presenting, how they're talking, how they're understanding things. And it's something that we spend a lot of time in our general practice training. And I feel it's a really, really important skill that we can really tease out their individual needs and preferences in a way that is really crucial. We also need to accept and acknowledge that people may vary in their views about the balance of risks, benefits, and consequences of treatments. And this is important, especially we see a lot of women in the clinic who have been told, absolutely, you can never have HRT. And these women actually have been more worried about their risk of not taking it. So a lot of women say, well, I'm really worried about osteoporosis. I know I may have an increased risk because, for example, I've had breast cancer before, but I'm prepared to take that risk. I would prefer to go through treatment for a recurrent breast cancer than to continue living like I am now. Yet every doctor I've seen before has told me absolutely no way. Well, if they're prepared to take an increased risk, which may be a theoretical rather than a real risk, but they know there are benefits and consequences, both good and bad, of that treatment, then they are allowed to accept and acknowledge, or we're allowed to accept and acknowledge that our views might be different to theirs. And that's really important. And also that, as I've said, their views and what they're prepared to undertake as risks and benefits may be very different from healthcare professionals. And we see this a lot in general practice with menopause care, that a lot of people are told you cannot have HRT, or you can only have it for a short period of time, or you can only have a certain dose. And actually, if my decision as a healthcare professional is different to a patient's, I need to explore that and work out, is this patient being reasonable? Have they got enough information to make that decision which differs to me? And that's really important. And obviously, we need to document these decisions really well. So, as an organisation, we should be prompting people to ask questions. So, what are my options? What are the possible benefits and risks to these options? And how can we make a decision together that's right for me? And one of the first things patients often say when they come to my clinic, say, thank you, I've been listened to. And that's really, really important, because if we're not listened to as patients, how on earth can we make decisions properly for us? And finally, I just wanted to share you with this. This is a shared decision-making document that we use in my clinic for patients who've had breast cancer. And this is really, it's not a consent process. It's really for them to show that they've had time and information to go through what are the potential risks of taking HRT following breast cancer, but also what are the benefits to them. Because whether a woman's had breast cancer or not, there are still benefits to their heart, bone and brains and symptoms and well-being from HRT. So actually, we it's optional, but if women choose to sign it, then it's something that they can show other consultants, other doctors, other healthcare professionals that they have decided to take treatment, which might have some risks with it, in a very shared decision-making process, and it really does empower them. So this is something that's been very useful for us to use in our clinic. So I hope that's been really useful. It's quite a dry presentation, not very exciting slides, but very basic fundamental principles of how we undertake our consultations. So thank you for listening.